Good morning, everyone. We're going to get started. We have a ton of content and information to share with you on this morning's call. So my name is Nigel Henley. I'm the Health and Physical Education Specialist for the Division of Health and Wellness. I want to welcome you all to the first of a new series of TA calls designed to get our customers, stakeholders, and partners the information and resources you need and want in a format that's easily accessible, integrated, of high quality, and embodies collaboration. On today's call, you will hear from members of almost each team here in Health and Wellness, as well as some of our community partners. So that we can get rolling this morning and leave as much time as possible for sharing of information, I'm going to ask my fellow OSSE colleagues on the call today, if you're comfortable, please come on camera and give a quick wave so our audience can see you. If you are presenting today, please take a few seconds at the beginning of your presentation or your share out to introduce yourselves to those joining us. We recognize that some of you may be very familiar with us and some of you may be learning who we are for the first time today. Before we jump into today's content, I want to take a minute to go over a few housekeeping items. As you may or may not have noticed, your microphones are currently muted. This is because we will be recording this call, sharing out the recording, and posting it on the OSSE website for later review. To ensure the highest quality recording, we have muted audience microphones in hopes of not picking up any additional background noise. To that end, if your camera is currently on and if you're comfortable, we welcome you to leave it on as it helps us feel a little bit more engaged with you in this virtual space. However, if you do not want your face living in the recording that is posted and shared out to those who could not join us today, now would be the best time to turn your camera off. There are several ways that you can engage with us today. As you're presenting and questions and comments come up for you, we encourage you to post them in the chat. Speaking of the chat, one of my fellow OSSE colleagues is going to put a message in the chat right about now to help you identify and find the feature. While you're there, we encourage you to introduce yourselves to us by chatting your name and organization or LEA. We will be facilitating a guided question and answer session where your chatted questions will be read aloud and answers provided with additional resources and points of contact you can reach out to for additional help. During the Q&A session, we'll also hold space for our audience to come off of mute and ask your questions. We ask that you use the raise hand feature if you're going to ask your question verbally. At that point, a panelist will unmute you and lower your hand and allow you to ask your question. With all of that said, I want to officially start today's call by handing it over to Caitlin Schock to go over today's agenda.
Awesome. Thanks so much, Nigel, and good morning, everyone. So my name is Caitlin Schock. I'm a policy analyst in the Division of Health and Wellness at OSSE, and I'll be moderating parts of our call today. So we're going to start out with a welcome from our Assistant Superintendent, Tia Brumstead, who's going to talk us through a bit of the reframing of these health and wellness calls. And then we are going to get some updates from each of the health and wellness teams. First, from the Healthy Schools and Wellness Programs team, our nutrition programs, and then finally, policy planning and strategic initiatives. And then we are so excited to welcome back our colleagues from DC Health for our deep dive. We're going to talk a bit about respiratory disease season. And then we're going to end with a survey. We really encourage folks to stick around for that survey because we're going to get some important information from you so that we can make sure that these calls are the most useful for you moving forward. So with that said, I will hand it over to Tia.
Thank you, Caitlin, and good morning, everyone. My name again is Tia Marie Brumstead. I'm the Assistant Sup for Health and Wellness here at OSSE. I'm really excited to join you all today. And again, thank you for your grace as we experienced some technical difficulties and began this call late. Many of you are familiar with the amazing team that I work with, my colleagues in our school nutrition and early childhood nutrition, and many health and PE spaces, school data, as well as school health policy. A lot of you all have sat on our COVID-19 technical assistance calls for several years now. So hopefully too many of y'all are not strangers to us. But we are really excited as we continue in this next phase of restoration to move these calls into the next wave of our work. And as Nigel said, truly embody an integrated spirit. So creating spaces for diverse multidisciplinary groups of stakeholders to come together, all in the spirit of supporting the whole child or supporting the whole school, whole community, whole child, and enjoying and engaging around specific health topics, but from a more integrated and holistic perspective. So today, instead of it being simply focused on one aspect policy, or data, you might see an integrated approach along with a lot of strategy and best practices. So we do encourage your participation. And we are again hoping that you will stick around and take the survey. This is the first of these new call series, and we want to hear all of your feedback to better understand what you believe will be most useful for you and your teams as you move forward. I'll hand it back to Nigel now. Thank you.
Thanks, Tia. So while we're focusing on cold and flu season, I just want to point out that the Healthy Schools and Wellness Program team delivers school health programs, supports, and resources designed to promote health outcomes for students, educators, staff, and school communities. As a reminder, OSSE Health and Wellness has issued DC state learning standards for health and physical education for each grade level. These standards are grounded in the greatest health trends within DC. They reflect a strong consensus among educators and establish high expectations for all students. They detail the knowledge and skills that students need to maintain and improve their health and well-being, prevent disease, and reduce risky behavior. This cold and flu season, we recommend including in your health education content on disease prevention. And on this slide, you can see the most applicable health education standards related to communicable diseases, such as the common cold and flu, outlined by grade band. So if you're seeing the slides, by grade 2, students should be able to identify the causes and common symptoms of illness, identify behaviors that promote health and prevent illness, explain how environments prevent the spread of germs, and demonstrate personal hygiene practices like hand washing, and covering coughs. By grade 5, we want children to be able to describe communicable diseases, determine when a person may need to go to the doctor, describe how bacteria, viruses, and other illnesses cause infectious disease, and identify personal health strategies that reduce risk of illness or reduce illness, and including receiving vaccinations. By grade 8, we want students to be able to explain why it's important to seek treatment for common infections. And by grade 12, we want students to be able to develop a personal health plan for preventing disease, analyze the efficacy of medical screenings for maintaining health and preventing disease. Please consider featuring and teaching concepts related to these standards this cold and flu season and reinforcing them throughout the school year. Each of these standards can be found in category 4 of the health education standards. You may visit the OSSE website to access the 2016 health education standards, and a link to the standards will be dropped in the chat in just a second. We also know that physical activity and exercise not only improve overall fitness, but also helps boost the immune system, and physically fit children and children who are more physically active are healthier children as well. So I would be remiss to not mention that the 2017 physical education standards are also available and should be used to support students to get moving and active this school year. Finally, in the spring of 2023, OSSE released the menstrual health education standards as an addendum to the health education standards. These standards take effect in the 23-24 school year. Both the physical education and menstrual health education standards can also be found on the OSSE website and are linked in the chat for your immediate use. Thank you all for your time and attention. At this time, I'd like to pass the mic over to our next panelist, Alex Dobbs.
Thank you so much, Nigel. So I'm Alex Dobbs, and I'm the school programs manager here at OSSE. And since we're talking about preventing illness, we wanted to discuss how nutrition, especially school meals, can support the immune system and aid in preventing illnesses. So fruits and vegetables can play a vital role in supporting good health and immunity year-round, especially during the cold and flu season. All schools that participate in the National School Lunch Program and the National School Breakfast Program require a minimum of a half a cup of fruit or vegetable with each reimbursable meal. School menus across the district serve a wide variety of fruits and vegetables containing antioxidant properties such as berries, broccoli, carrots, oranges, pineapples, and tomatoes. And antioxidants protect healthy cells and help reduce damage and infections. So per the National School Lunch Meal Pattern Guidelines, all schools must offer vegetables at lunch from 5 subgroups on a weekly basis, which promotes a balance from a variety of vitamins and minerals. Every day a student is absent from school due to an illness may result in a missed meal, which is an opportunity for vital nutrition. So if your school is looking for a creative way to incorporate more variety into school meals, you can visit the Child Nutrition Recipe Box for more ideas. And then since I have you all, I wanted to talk about some important due dates that are coming up. So many of you have already submitted your NSLP application and have it approved, but if not, October 30th is the final day for NSLP application approval if you want to be paid out for your September meals. On November 1st and 2nd, we'll have a claims training and the invite will be sent out later this week for that. November 15th is the deadline to complete verification if you are a standard claiming site. And then on the 15th, the FNS 742 is due, and your program specialist will be sending out the forms and instructions on how to fill that out shortly. And then I just wanted to talk about DC after school meals. So through the Child and Adult Care Food Program, or what we call CACFP after school meals, SFAs may receive federal reimbursement for meals and snacks served to students during after school hours. Students who are 18 and younger at the start of the school year may participate. So what is the program eligibility for CACFP? You must provide programming for students after school, on the weekends, holidays, or school vacations during the regular school year. Be located in an attendance area where 50% or more of children are eligible for free or reduced price meals. Provide organized education or enrichment activities, and the programs may either be drop-in or enrolled. So examples include enrichment activities, which could be like music lessons, chess club, dance. It could be tutoring or homework assistance, and those programs must be open to all students. It could be students attending a one-time event or drop-in tutoring, or homework help can also serve the meals. And then students must remain on site while consuming meals. To participate in CACFP after school meals, schools must have a current approved NSLP application. So that's the application I was just talking about. And then applications for CACFP are due within 30 days of initiating that application in Orchard. And for more information on CACFP, you can reach out to my colleague, Monica Clark, whose email address is listed here for you all. And I will pass it off to Lisbeth, who will talk to us about allergy management.
Good morning, everyone. My name is Lisbeth Garcia with the Policy Planning and Strategic Initiatives. I am presenting a little bit today about the Allergy Management Program, which is also known as the EpiPens in schools or epinephrine in schools. And just as a reminder, schools, both public and public charter schools in DC are required to have a minimum of 2 undesignated epinephrine auto-injectors. These are also known as EpiPens. And they need to be of each dose to be used in the event of any anaphylactic emergencies. In general, schools receive 2 doses of the pediatric auto-injectors and 2 doses of the adult auto-injectors. And OSSE, in partnership with Mylan and BioReach, provides these free auto-injectors for schools and also provides free replacement for used, damaged, or expired auto-injectors. All public and public charter schools are also required to have a minimum of 2 staff members outside of the school nurse trained in the identification and treatment of anaphylactic reaction and emergency administration of epinephrine. We provide trainings throughout the school year to assist in this requirement, and the upcoming live training is happening on November 16 at 10 a.m. and you can sign up. We will share the link in a few minutes. But just as a quick overview, this program is vital, ensuring that students have access to epinephrine in case that they have a severe allergic reaction, whether to a food, so if they have a food allergy, or if they are stung by a bee or have any reactions due to medication, etc. And in this last school year, 2022-2023, we received a total of 24 incident reports, which means that there were 24 incidents in which a student or staff member received an epinephrine administration. And just a quick reminder to ensure that your school is in compliance, but most importantly, ready to treat in case of an anaphylactic reaction, it is important that you submit the 2023-2024 undesignated autoinjector plan or UEA plan to us. And also, whenever your school has an incident where an autoinjector, an undesignated or emergency autoinjector is used, it is very important that you submit an incident report within 24 hours of using that autoinjector so that we can quickly replenish it, and we can also have that information on file to ensure that your school receives the autoinjectors and is prepared in the event of a future emergency. Next slide, please. As I was mentioning, we provide these trainings. We provide an on-demand training that school staff can take at their own convenience. And also we have live virtual training that we host. The next one is coming up on November 16, and the link will be shared so you can sign up and share with other school staff members who should be receiving the training. The minimum is 2 staff members outside of the school nurse, but there is no maximum, and some schools choose to have additional staff members. So the more staff members that are trained on how to identify and treat and respond to these type of emergencies, the better. And then we are partnering with our national partner fair, or Food Allergy Research and Education, and we are hosting a webinar coming up on October 25th, I believe it's on Wednesday, covering the impact of food allergies in students' mental health. So if you're interested, we will also share the link for you to sign up. And this is open for school staff and also parents. So you can learn more about the impact of food allergies on students' mental health. And then for more information, you can also contact us via email at OSSE.epi or epi@dc.gov. And we will also share the link to our website where you can learn more and find out templates for the UEA plan, the incident report, etc. So thank you so much, and I'll hand it over to Kyle.
Good morning. I wanted to offer some reminders of where we are with this school immunization policy for this school year. As we all know, immunizations are the best defense against some of the most common and sometimes deadly infectious diseases. And since the 1970s, District of Columbia has required that students receive their immunizations in order to enroll and attend school. Beginning this school year, if a student is enrolled in any of these 4 key grades of pre-K 3, kindergarten, 7, or 11, and if they remain out of compliance, meaning they haven't submitted their vaccination records or they haven't received a religious or medical exemption, if they remain non-compliant after October 5th, which was just a few weeks ago, also referred to as count day, then those students would be eligible for temporary exclusion until they come into compliance. So I'm going to go over the timeline in just a moment, but another quick reminder is that if a student is subsequently removed in one of those 4 key grades temporarily until they come into compliance, schools are reminded to use the correct attendance codes, which would be unexcused absence for immunization, or AFUI, for those days while they are out. So here's a quick look at the timeline for the school immunization policy. You'll see in blue throughout the spring and summer, schools were conducting their routine review of immunization records and ensuring that the students that were enrolling or preparing to enroll for the upcoming school year were up to date on their vaccinations. Following October 5th, earlier this month, we hit enrollment count day. And where we are now, you'll see the little red arrow, is schools are developing their written notifications to go out to those students in those 4 key grades who are still missing their immunization records or exemption records. Again, that's pre-K 3, kindergarten, 7, and 11. Schools will be preparing to send out these warning notifications to those families, reminding them to submit their documents by, and those will go out on October 26th. Then throughout the month of November, schools are encouraged to continue working with those families and redirecting them to immunization opportunities throughout the district to receive a free immunization before December. And if a student is still missing their certification beginning on December 4th, that's when the temporary exclusion would begin for those 4 key grades. So immediate next steps for schools. Schools are reminded to continue to collect those records and make sure that they are input into the data systems to confirm that the student is up to date and that your school is showing good compliance for that student and for the overall compliance of the school. Right now, schools are identifying those students that are missing their records in those 4 key grades to send out the notification on October 26th. Schools are encouraged to direct families to their primary care providers or to free mobile immunization opportunities that are placed throughout the district. You'll see linked here, and we'll include in the chat in the follow-up notes, links to where families can access pediatric immunizations throughout the district, as well as mobile opportunities near schools that are convenient to families. As a reminder, as I mentioned, if a student is subsequently removed beginning in December, schools are reminded to use the proper attendance coding for those students. Only students in grades pre-K 3, kindergarten, 7, and 11 would be eligible for temporary exclusion, and students who are experiencing homelessness should never be excluded. There are federal protections to keep students experiencing homelessness in school, so you continue to work with those families and those students, but do not exclude them if they're missing their vaccination records. You'll see here, OSSE has refreshed our website, and we have a lot of great resources and trainings available on our website for schools, and also links and resources for families, school nurses, and others on our refreshed website. I encourage everyone to check it out and familiarize themselves with the policy and the resources. And the DC Health website is where families and school staff can go to learn more about pediatric vaccination opportunities throughout the district. There's currently a calendar for October available where you can direct families to go. OSSE has also released a media toolkit, and we encourage schools and partners to share information through social media and newsletters around these reminders for getting vaccinated. The media toolkit has lots of examples for how you can share messages and images around this. Public charter schools are also encouraged to reach out to Deanna Bruce or Sharon Bostic, who can provide support to charter schools in navigating this process. And I wanted to offer some quick COVID-19 reminders before we move over to DC Health to hear more about the main presentation. So COVID-19 vaccines are not required for school attendance this year. DC Council recently passed a repeal of that requirement. The COVID-19 vaccines are still strongly encouraged for all eligible groups. Note that there is the updated COVID-19 vaccine. Individuals are encouraged to use the mobile or pediatric vaccination sites if they need access, or to go through their primary care provider and to contact their primary care provider if they have questions. There's a reminder to check your insurance coverage when scheduling a COVID-19 appointment with a pharmacy such as CVS or Walgreens. Reimbursement is a little bit different this year. And you can go to vaccines.gov to also find sites near you. The Biden administration has also revived the COVID-19 free test kit distribution directly to US households. Each US household can receive up to 4 free COVID-19 vaccine tests mailed directly to your home. And the link to sign up for your free kits is available in the slide here and placed in the chat. And we're offering a quick reminder that the FDA has extended the expiration date for many at-home tests. So before you throw out an unused test, we're encouraging you to go to the FDA website linked here to double check to see if that test is actually still good. DC Health has also worked with local partners to place free COVID-19 rapid tests at sites throughout the district for uninsured individuals who are symptomatic or who have been exposed to COVID-19 to get a free COVID-19 test. And a link to those sites is also available on the slide and will be dropped in the chat. As we move into the next portion of our presentation, I did want to bring in Michelle Lee from DC Health to pose a few questions around the COVID-19 vaccine specifically that we've already been receiving. So Michelle, the CDC recommends everyone aged 6 months and older should be receiving the updated COVID-19 vaccine that's currently available. Can someone get the updated vaccine if they have already received some of the previous COVID-19 vaccines?
Good morning. And yes, so CDC does recommend that anyone who has previously received a COVID-19 vaccine to receive this year's updated 2023-2024 vaccine. So if you've gotten your vaccine within the past 2 months, it's just recommended you wait 2 months, then you can get the 2023-2024 booster.
And if someone has never received the COVID-19 vaccine, do they need to catch up on the previous vaccines, or do they only need to receive the current updated COVID vaccine?
Yeah, so for individuals who have never received a COVID vaccine, they just need to receive this year's 2023-2024 vaccine to be considered up to date. So there's no catching up and needing to get past doses. But if you have any specific questions on that, you can definitely reach out to your primary care provider as well.
Great. And if someone has recently recovered from COVID-19, should they get their vaccination?
Yes, so it is recommended if you have recently had a COVID-19 infection to get your COVID-19 2023-2024 vaccine as well. It'll just continue to protect you from the current strain of COVID-19 that's circulating in the community. So if you currently have COVID-19, you should wait until you have been, you're symptom free and that you've cleared your isolation, and then you can go get your updated 2023-2024 vaccine.
Great. And then the final frequent question we get is, can you receive your updated COVID vaccine and your flu vaccine at the same time?
Yes, you can. So CDC does recommend that if you that you can get both at the same time. And so if you sign up at your local pharmacy, CVS, Walgreens, you should be able to get both. If you have any concerns about getting both, definitely reach out to your primary care provider because they can definitely provide you additional guidance on what is best for you.
Great, thank you. That was all of our questions, and I'll hand it over to you now to go through your respiratory disease season presentation.
Great. Good morning. Yeah, my name is Michelle Lee. I am an epidemiologist at the DC Department of Health. I work on school health and outbreaks investigation, so I work closely with the OSSE team throughout the year. So yeah, and today I'll be speaking about just respiratory disease season, speaking about influenza, COVID-19, and RSV specifically. So just an overview. So we know that, viruses that cause respiratory diseases like flu, COVID-19, and RSV tend to circulate more throughout this fall and winter season, and we're kind of coming up on that season. Most people who become ill with respiratory viruses like flu, COVID, and RSV usually recover, without any serious illness or complications. But these illnesses can cause serious complications, hospitalizations, and death in older adults, very young children, pregnant persons, and persons of all age who are immunocompromised. And even for those who don't become seriously ill or hospitalized, it can lead to individuals missing work and school and other important events in their lives. So it's important to take everyday prevention measures to stop the spread of respiratory illnesses. So first I'll kind of do a little bit of a deeper dive into the flu. So flu is a respiratory illness that's caused by the influenza virus, and it infects the nose, throat, and sometimes the lungs, and it can cause mild to severe illness and at times can lead to death, especially in older adults and those who are immunocompromised. And we know that influenza viruses spread mainly through tiny droplets that are made when people with the flu cough, sneeze, or even talk. People with the flu are most contagious in their first 3 to 4 days after their illness begins. So the flu virus can be detected in most infected people from 1 day prior to the symptoms beginning, up to 5 to 7 days of them becoming sick. and younger children, infants, and people with weakened immune systems who are infected with flu viruses can be contagious for longer than 7 days. So once you've been exposed to the flu symptoms typically begin 2 days after that exposure, but it can kind of range between 1 to 4 days. There are a variety of different symptoms that people experience who have the flu, so fever, cough, sore throat, runny nose, body aches, headaches, so very a wide range of symptoms. And people can be infected with the flu virus and have no symptoms and still spread it to others, which is why it's really important to take, prevention measures. What are those prevention measures? So there's a lot of things that we can do every day to prevent getting the flu or even protecting others from getting the flu. So staying away from people who are sick, covering our cough and sneezes, and good hand hygiene can help slow the spread of germs that cause respiratory illnesses. But we know that especially with the flu, the vaccine is one of the most important steps you can take in preventing getting the flu as well as preventing serious illness. So for the flu vaccine, CDC recommends that all persons 6 months and older receive their routine flu vaccine every single year. So the flu vaccine is different every single year based on the kind of the flu viruses that are circulating in the community. So it's really important to get a flu vaccine every single year. So if you have any questions on, what type of flu vaccine you should get or when you should get it, definitely reach out to your primary care provider because they will be able to provide you the best guidance based on your personal medical history. And then CDC has a great resource where you can find where you can get a flu vaccine that's close to you. So that link is in the slides as well as in the chat. And then just quickly, just seeing where we're at with, outpatient respiratory illness. So great news is that DC has pretty low outpatient respiratory illness, which is good. And for the most of the country, we're seeing kind of low activity. So we're keeping our fingers crossed that stays that way. And that's great news. So next I'll be speaking on COVID-19. So we know that COVID-19 is caused by the SARS-CoV-2 vaccine. And so similar to kind of flu, there's a lot of different symptoms that people experience when people have COVID, and it can range from really mild symptoms and mild illness to severe illness. We know that symptoms, once you're exposed to the virus, symptoms can appear between 2 to 14 days after exposure, but anyone who has COVID-19, whether symptomatic or not experiencing any symptoms, can spread COVID-19. So there's a lot of different ways we can prevent the spread of COVID-19. So we can improve ventilation, to get tested if you have been exposed or if you're experiencing symptoms. If you've been exposed, following recommendations, following exposure, staying home if you're not feeling well, or if you have confirmed COVID-19. If you have COVID-19, seeking treatment with your healthcare provider if you're at high risk of getting sick. Avoiding contact with people who are sick or who have confirmed COVID-19, and then staying up to date on the COVID-19 vaccines, which we spoke about with Kyle. And then great news again, in DC, we're seeing low community levels. So we're seeing low hospitals admissions rate and then low inpatient bed usage among COVID patients. So really good news, and that's definitely what we hope continues out this season. And then next, I'll quickly speak on RSV. So RSV is another common respiratory virus that causes mild cold-like symptoms. So again, spreads via respiratory virus droplets through cough, sneeze, direct contact. RSVs can survive for many hours on hard surfaces and then for a shorter amount of time on soft surfaces. So this is why cleaning and disinfection is also a great prevention method as well. People infected with RSV are usually contagious for 3 to 8 days. and can become contagious 1 to 2 days before they start showing any signs of illness. And specifically with RSV, so most people usually have pretty mild illness, but typically younger children, so children under the age of 2 or older adults, so 60 and older, are more likely to develop severe RSV and may require hospitalization. So this year is actually the first year where there are actually vaccines and immunizations available to protect older adults, pregnant persons from RSV, as well as children under the age of 2. So at this time, because for individuals aged 3 to 59, most people experience pretty mild illness. There's no vaccine recommendation for those individuals except for those who are pregnant. So just wanted to give a quick overview on what various infectious disease experts are predicting for this next season. So there are different forecasting models that are used to kind of see what may happen. So overall, they're expecting a total number of hospitalizations to kind of be compared to last year. So for the flu, they're expecting a typical season, but even typical seasons, they know that the numbers of illness, hospitalizations, and death can range widely. For COVID-19, they're expecting a wave that causes as many hospitalizations at the peak that occurred at last year's peak. And then for RSV, they're expecting a normal season following last year's severe season. So there are a lot of different factors that can play into what this respiratory disease season will look like. So it is important to take everyday prevention measures like practicing good hand hygiene, avoiding people who are sick, and staying home when you yourself are sick to protect yourself and those around you. And then vaccination remains one of the best ways to protect yourself from respiratory diseases as well as to prevent severe illness. And this is the first year that there are vaccinations available for all 3 respiratory diseases that we talked about, especially for those who are high risk for severe disease. So we all play a role in keeping ourselves healthy and protecting the people around us. And that's it from me. I will pass it back to Caitlin for.
Yes. Awesome. Thank you so much, Michelle. First of all, for joining us, and then also for that great overview. Like you just said, you took the words out of my mouth. All of us, there is something that we can do to help contribute to the health and safety of our schools by, we have 3 different respiratory illnesses that you talked through. We know it's cold. There's lots of sniffles going around this time of year, and we can all play our part, whether it's, good hand washing or getting vaccinated if we're eligible for a different vaccine. There's something that everyone can do regardless of what their role is in the school to help contribute to a healthy environment this fall. So thank you so much for sharing all that with us. And I know that I don't see any questions in the chat. I know a lot of folks that were able to join are on their phones, but what we are going to do is drop into the chat the OSSE.schoolhealth email account. If you have any questions in general or following up from today's call, please always feel free to email us. Again, that's OSSE.schoolhealth@dc.gov. And also, again, we know a lot of folks had trouble joining via computer. So if you have any colleagues that were unable to join, we will be sending out the recording of this call via email. So they will get that soon. And also, Tia just dropped into the chat. Please make sure you're signed up for our division newsletter, Thriving Together, where we continue these types of cross-cutting conversations about how we all play a role in supporting the whole school, whole community, whole child model, and making sure that our schools are thinking about health holistically. So with that said, we're right at time. I'm going to hand it over to Nigel to talk about our survey.
Hi, everyone. Really quick, we are going to drop a link to a survey in the chat right now. We ask that you please take 1 to 2 minutes to complete that survey. As I shared earlier, this is a pilot for us. And we want to ensure that we are providing you all the information, the resources, and the content that you want to hear about in these calls. And the only way that we can do that is by hearing your voice via this survey. So if you have 1 to 2 minutes, we encourage you to fill that out. Within that survey, number one, most importantly, it's anonymous, so we won't see your feedback specifically about how today's call went, but most importantly, we ask in that survey a question around what content you want to hear in subsequent calls like this. And so for us to be able to deliver on that promise of providing cross-cutting, integrated, and important content information for you all, we need to know what that content is. So take 2 minutes, 1 minute if you skim for details like me, to complete that survey, and we would greatly appreciate it. With that said, we're going to close out this session. It is 11:02, so we're just 2 minutes over, but we want to thank you all for joining. Again, we do apologize for the technical delays and issues in the beginning of this call, but we look forward to seeing you in subsequent calls. Thanks, everyone.